What are the major impacts that you've seen on communities in your respective countries? And do you think there's an increased scope for collective trauma now in the light of the COVID-19 crisis?
Compared to developed countries where the systems offer security and stability, our communities have been facing ongoing challenges and are in many ways somewhat resilient to crisis. But the impact of this pandemic has been palpable. In view of the dearth of our resource, it has taken us the last 3-4 months to organize a basic emergency response. The greatest stressor has been access to healthcare for those who were infected or who were at risk for infection. And the second greatest challenge has been loss of income. And this has particularly hit those who are non-salaried or working on daily wages. Your question about collective trauma is definitely valid. The closer communities have suffered collective trauma, but I think that even those communities which are geographically not closely located, because of the exposure to media, have also been suffering together since the pandemic. In Pakistani communities, faith has been instrumental in dealing with the crisis and helping people recover.
Dr. Patare, perhaps you can say something on this question.
Interestingly enough, in India, the first people with mental health problems to experience the impact of COVID was people who were dependent on alcohol, for example. So, in the couple of weeks after lockdown was declared, we had almost 25 or 30 suicides, which were related to non-availability of alcohol and people going into alcohol withdrawal, and then there was suicide. So that was the group which got initially affected. Then as people got out of withdrawal, that kind of seemed to have gone away. And then other concerns started coming up. And as the lockdown has got extended over periods of time, we started with a 3-week lockdown and then another 3 weeks and then another 3 weeks. I think it has started to test people's coping capacities and resilience. And then you started getting a different bunch of people experiencing mental health problems. So that it started with people who had severe mental disorders, for example, not getting access to their medicines because supply chains of drugs got disrupted, or not having access to psychiatrists because they're regular clinicians because of the lockdown. So you started seeing that kind of group getting affected. And now as the lockdown has gone on, you start seeing the effects, mental health effects also start to appear on children and adolescents because now, schools have been shut for a while. There is a question of school exams. Are they happening, not happening? When will colleges reopen? And all of those issues coming in. And now you also start seeing a whole new bunch of people getting affected. And those are people who are now beginning to worry about what's going to happen to my job. Will I have a job when this whole thing gets over? So it's kind of gone in phases, and different people, different groups of people have got affected at different times. I think one of the things that you don't see in the writings from outside, maybe South Asia, is the notion of collective trauma. And some of the things that I worry about is how we managed our pandemic response. So for example, families not being able to do the last rites for people who died in their family. And that can create a real problem as we go forward, in terms of grief reactions, which have not been dealt with at all. So I think those are the things that we've not really dealt with, or the kind of reactions that people are getting to if somebody's been, if you live in a block of flats and somebody's been diagnosed with COVID, and then the ostracization that happened of that family or that person.
Dr. Somasundaram, perhaps you can weigh in on this question.
Fear and anxiety that was there prevalent, it seems to be diminishing quite a bit now, and in fact it may be increasing the risk of the second wave and so on when people don't follow the restrictions like social distancing or staying at home when in various, like in shops or in temples or religious festivals and so on. Another common mental health problem that we saw was kind of obsessive cleanliness. People who had this predisposition, and also maybe many who were not clinically, who became very in fact, there was a kind of a phobia for the virus and whether they will get infected, and this. So there were a group of people who were extremely careful and cleaning, and as mentioned already, the problems of people who were dependent or addicted to various substances, not only alcohol, so even the narcotic, heroin, and so on. They went into severe reaction, and that's a big problem managing any of these patients who became quite ill in the withdrawal. In the longer term, I think some of the problems cropped up because of the lockdown, access to medication, people being able to come to psychiatric clinic. So many of the more severe illnesses, there were relapses, and people tended to develop these problems at home and then had to be managed there without the proper medical care and so on. So these issues also cropped up. Belatedly, people are beginning to recognize that now in the recovery phase, we are going to face a host of mental health problems due to what has happened, and also the economic issues and the deaths that have happened and the separations and all the difficulties that people have gone through. There is going to be a whole host of problems that are going to crop up. They're even saying that it will be a kind of a third wave, the mental health problems in the post-COVID time, depression, suicides, anxiety, and so on. So I don't think the facilities and even authorities are actually ready for this and are planning how they are going to deal with this. So I think we may face these problems. Now, the problem of collective trauma is more difficult. The collective impact on society is immense. I think many of the normal processes and structures and the way that society functions has been impacted by these long lockdowns and way that people have been kept at home and so on. So to get back to a kind of social normality is going to be different. In fact, there are predictions that we will never be the same again. Society in the post-COVID era will be a different type of society with different priorities and values and so on.